The cause of a pinched nerve, mainly being sciatica, is not primarily from a herniated disc. Now, many people may differ with that opinion, although with the hundreds and hundreds of MRIs that I have seen with patients, I can tell you that the majority of sciatica is not from the herniated disc. Just because you have a herniated disc or a bulging disc does not even mean you're going to be symptomatic. Better yet, we can take 1,000 people and we'll find a very high percentage of these people with herniated discs that are asymptomatic. Depending upon where the nerve root is compressed, not from the herniated disc, not from the bulging disc, but from where the nerve root is irritated and compressed, will be determined upon that sciatic condition. Although once that sciatic nerve comes off of that spinal cord, it exits down into the buttocks region. We have L4, L5, S1, S2, S3 that forms a sciatic nerve. That nerve, the size of your thumb, the largest, longest nerve of the body, comes underneath the buttocks, goes down the back of the thigh, outside the thigh, and not the front of the thigh. So therefore, if you're having symptoms in the front of the thigh, you can rule out sciatica. And once it gets down to the knee, it branches off to the rest of the foot and the toes, including the whole lower part of that leg below the knee. The only point that sciatica does not touch is the front of the thigh or quadricep region. Now we look at poor posture. We look at pronated shoulders. We look at continued hip flexion, particularly while sitting in a vehicle, sitting at your computer, sitting at your iPad, whatever you're doing. This position of bending the knees up, being in a seated position, is causing a lot of postural distortion, causing the shoulders to go forward, causing imbalance on the pelvic, and causing muscles to contract. This over time causes a kinetic chain imbalance, affecting the whole entire body, causing the gluteus maximus, the gluteus minimus, medius, those muscles in our buttocks region to become altered. This affects our gait, causing imbalance, mainly piriformis syndrome. When the piriformis muscle, called the external rotator, which externally rotates the hip outward, that particular area, when that muscle contracts and shortens, it will affect that sciatic nerve which goes down the buttocks into the leg. The problem here is that everyone is running, looking for the fast answer. They run to the MRI, the CAT scan, and they say, oh, a herniated disc, and boom, they focus their energy into where the objective finding is present. Although objective findings mean nothing, clinical findings mean everything. Now, I like to get your impact, your feedback from where you've been, because I know you're listening if you've had some type of sciatic or nerve root or pinched nerve problem. But you'll see that when you have this particular problem, you're running, looking, searching for answers, trying to target what the objective finding is saying. Objective findings mean nothing. It only means something clinically. If you're not symptomatic, you leave it alone. Although, instead of trying to get the epidural shots, being on the hard medicine, the cortisone, the steroids, and all this other invasive anti-inflammatories like the Motrin, Advil, naproxen, all these types of medicines, you need to get to the fundamentals of the biomechanics. Are the mechanics off? Is the pelvic one sitting up higher than the other? Is the piriformis shortened? Is my core very weak? Need to strengthen core muscles. Am I carrying too much weight around the abdominal area? What am I sedentary type of work? Do I exercise? Do I strengthen core? These are questions that you have to look at. Are you sitting at a computer for hours without getting up, changing positions? Do you have a support behind your lower back? These are the common questions. Now, I can tell you the power that made your body, the power that made my body is the same power that's going to heal our body. So we need to direct our mind more inside of ourselves rather than trying to search for answers on the outside. You're wasting time. This video is not about me. It's not about other doctors. It's about you. It's giving you the best choices, the best understanding, and giving you a door that's open that you can walk through, that you can find answers and treat this condition wisely. If you're going to spend lots of dollars and your insurance and hard-earned monies, as well as put drugs in your body and tax your organs like your liver, your kidneys, and affect your whole cardiovascular system, you need to think twice. Now listen, I'm telling you from experience, you can get through this, but you got to do it right. If it's inflamed, you use ice more, change your postural activities, get off your stomach, keep the knees bent if you're on your back or your side, pillow underneath on your knees if you're on your back, pillow between the knees if you're on your side. Do things more wisely. Stretch the ab muscles, stretch the chest muscles, watch your posture, strengthen the rhomboid muscles. And I can go on and on. Now there's a lot of videos I have here on YouTube, many hundreds of videos. You can go through them. I have great information for you. I do this for you, not for me. I do it from my heart, but I do it for you. So take the time, learn. I ask you to share this video with your friends. I ask you please do so to help these people. And I also ask you to leave your comments below, that if you have anything you'd like to say or mention about your particular condition, leave it below. But most important, I ask you to make it a great day. I'm Dr. Alan Mandell.